All right, hello everyone, and thank you for joining us today for a webinar on global health. We're happy to have you spend some time with us today. This is the first webinar for Innovations in Education in partnership with EDU Africa, and I'll tell you a little bit more about the companies and introductions in just a second. A couple housekeeping items. We are recording. We cast a very wide net to different audience members, knowing that not everyone can meet in the middle of the day. So we will be using this webinar recording for social media posting. And please share it with your network as well. You likely have colleagues that have interest in this area who may not have made it. So please share as well. Questions can be asked as we go along or put in the chat. And we look forward to telling you a little bit more about this webinar. I'll be hosting. I am one of the co-founders of Innovations in Education, along with Donna, who will introduce herself in a second. And Innovations in Education, or IE, is really a consulting company that was brought together with the shared vision that Donna and I had in really guiding educators for a creation or transformation of learning environments, really to meet students where they were at through experiential or innovative methods. And global health is certainly a experiential learning topic. So this is something that she and I have done together for over 20 years and have formalized it. So that's Innovations in Education. A little bit more about me. I am a PA by training, also a mom of 7 from 6 to 24, so a lot of education around kids that different ways of educating. My interest in global health really occurred over 20 years ago when Donna invited me to create a course to Nicaragua. And when I was a consumer and traveler of international options at that time, but I wasn't a learner. So as a faculty, I also got to see how that impacted students. And from that, at that time on, have really had a priority of what global health education can do for transforming students' experiences. So with that, I'll pass that on to Donna for her introductions.
Okay, I'm Donna DeGracia. I'm also a retired now PA, but worked as a PA for my career spanned over 40 years. My career in education actually started in the Peace Corps when I taught English as a second language in university. I've also taught English as a second language from preschool through college and have spent over 20 years in PA education. So my interest in global health actually goes way back to probably to childhood, but to the 1970s at least. And like Heather said, we have done quite a bit together in both consulting and also in global health networking, creating courses, presenting at conferences, etc. So yes, and my experience in global health has been everything from setting up rotations for students to doing global health research and being involved in other interprofessional programs that have been a lot of fun. More on that later. So I'll turn it over to EDU Africa so that Heidi and Adrian can introduce themselves and their organization. You can see how we collaborate.
Thank you very much. Thanks for having us. And it's been really fun collaborating with Innovations in Education so far. And we're excited about the work and the program that we're working on. So EDU Africa is an organization that works to develop and facilitate educational programs in Africa. And the sort of common thread across all our programs is this desire to encourage meaningful transformation. I am Adrian Marskalk. I am the operations director for Southern and East Africa, and I'm ultimately responsible for smooth and safe logistical operations and participant support on all our programs. I'm also responsible to ensure that what we promise our participants, that those promises are delivered, that learning outcomes are achieved, and to that end, I make sure that our team are well trained and equipped to provide a transformative learning journey for each and every one of our participants. So that's a little brief about me, and I'll hand over to Heidi to introduce herself.
Thank you, Adrian and Donna and Heather. It's lovely to be here with you. So my name is Heidi Barnes. I'm the Academic Director at EDU Africa. I'm responsible for our curricular and co-curricular planning and advising, and ensuring ultimately that all of our programs follow a transformative learning framework in some way or form. I am classically trained in English literature, but my doctoral studies was focused on transnational feminism. So I'm particularly interested in ways that we can connect across race, nation, space, age, meaningfully. And my studies specifically focus on how women can do that, but I'm interested in all different kinds of partnerships. I think in terms of global health, EDU Africa has run quite a few faculty-led programs in the global health space before. And we've also run 2 iterations of our own public health program in Tanzania. So it's a space that we're particularly passionate about, and just understand the importance of running well and doing it right. So we're really excited about this, this partnership and the potential to bring global health educators to Kenya.
Very good. Thank you all for introductions. I would echo it's truly been a fun preparation in our collaboration as well. So we will move on to why is engagement in global health important? And as you can see, this is a webinar that has subject matter experts on it. So we will continue with a panel format. And so I will kick us off with just my own perspective, because then after that, I'll do more moderating. I have really seen implementing global health education into a student's education or others who have not experienced that to be truly transformational. Sometimes we try to teach certain concepts that just don't come across in ways that we do with traditional teaching methods. And it shifts people's perspectives on what they're going to do on the outlook of their profession or even their personal life. So really have found it an important part of the experiential learning of graduate education that can be shared outside of graduate or health in particular. So let's start out with Donna. What would you say? Why do you find engagement of global health education important?
I think there are a lot of reasons, and you've touched on some of them. But from an institutional perspective, I think that we look at a draw for students in what sets one program apart from another. And students definitely want to engage in global health. It's something that surveys have shown over and over again. It also makes the program stand out in terms of leadership, because this type of transformative education creates passion in students and creates leadership. And that then kind of segues into the personal level. And I know for myself, it's been very enlightening and has given me a lot of personal growth. I also think of a former student who went to Nicaragua on one of the trips that Heather mentioned earlier, probably over 20 years ago. That student then graduated from PA school and pursued a career in oncology, became a member of a board of a foundation that is working with cancer care in Tanzania, and has just finished her doctorate on radiotherapy in Ethiopia. So this has really been extremely transformative and has shaped her life considerably. I'm going to turn it over to Adrian and Heidi now to talk about their perspective as, from the other side of the world.
It's a partnership, right? Tell us a little bit about the global partners.
Yeah, thanks. Thank you. And Heidi, feel free to chip in at any point. But yeah, I think it's important, for all the reasons that Donna mentioned, but for the global partners in particular that are involved, that participants and students are connecting with. There are many real benefits, and some of those include information sharing or knowledge exchange. These programs these types of programs provide a platform for growth in intercultural competence. And so, of course, we want our students and participants to grow themselves, but there's also, on the flip side of that, there's this opportunity for local members of local organizations that are engaging with the students to understand how to interact with people from overseas. As I said, there's an opportunity for collaboration and exchange of knowledge. Again, this works both ways, but it's often the environment obviously looks very different, in one country as opposed to the other, and so there's a real rich opportunity for sharing and comparing and contrasting how things are done, and then often when groups travel abroad, they, especially to developing countries, they're able to bring resources and donations that can be very beneficial to some of the partner organizations. So those are a few things we've obviously worked with a number of different partners, and so those are just a couple of points that they raised with me. But yes, we've seen it in practice, and this idea of transformation is very it's very, we work very hard to ensure that our international participants are experiencing transformation, but we're equally interested and excited to ensure that our programming enables transformation in the partners on the ground in the countries we operate in. Heidi, not sure if you got anything to add to that.
No, that was good.
That was very nice. Would any of you have something to add about how global health is important in the bigger global perspective? Like, what does this mean outside of the countries that are participating?
You can see I'm chomping at the bit to jump in on that. But no, I mean, one thing that's always been a passion of mine has been disparity, both in the United States and globally. And partnerships make such a huge difference, because without them, we don't know how to approach problem solving that has to do with a larger context in the world. And we've been focusing on education and educational institutions, but the programming that we do is also very apropos to business groups, to professionals on their own, not only to educational groups. I'm just going to close this part with an example. We were doing some research with our global partners to find out how we really, what is the impact for our global partners, not only for ourselves. And one person that I interviewed really put it so well. He was actually a warehouse worker at a clinic in Haiti, and he said that a partnership is like a tree. It starts out as just a small little branch, but it branches out both upwards and downwards in the roots and in the branches, and you never know where it's going to go, but it can just expand to into things of beauty.
Yeah, that's very nice. Great way to close that section. We're going to shift perspective a little bit and talk about what kind of components might someone need to think about if they were interested in including any global health education into either their own programming, maybe their clients, maybe their business partners, or perhaps just even for their own personal or professional growth. So here again, I'm going to have some of our panelists talk to some particular questions. So tell us a little bit about global partners and finding mutual goals as to why the experience you're creating exists the way it does.
Okay, I'll start you off. I'm just going to use an example. I was lucky enough to be involved with a group that was trying to address problems related to children with disabilities. We were working in Zambia. And this was an interprofessional group of faculty from public health, medical programs, OT, PT, different nutrition. And when we started out, we started with course, literature search, we were academics. And our idea was that children were in institutions, they were being neglected. We needed to get them out of there. When we went to Zambia, we met with a lot of people there, a lot of different organizations. And we finally found a partner in the Catholic Medical Mission Board that had a children's group, and they were interested in disability, but had not been able to focus on that because of HIV and child abuse and other issues that they really had to pay more attention to. So with them and in partnership with them, our entire focus changed. And what we ended up with was a program that started as a train the trainers program for basically community health workers, but it was based on quite a bit of research that was done initially to really look at how the community health workers in the community could do things to improve the lives of the children. And one of our big focuses ended up on stigma. But this, like the tree, grew roots and grew branches. And we had students who were creating videos that could be used for training purposes on different causes of disability, so educational videos. And jumping forward, our program then was adopted by the government in Zambia, and the Catholic Medical Mission Board was really considering starting very similar programs in other countries where they work. So again, finding a partnership. Without that partnership, we would have been spinning our wheels, not knowing where to start or what to do.
That's a great example of having some of your own goals, but using partnership to finesse and meet both parties' needs. There's going to be a lot of logistics. We talk about how is an opportunity like this sustainable across time, or how do we make sure reciprocity is important when designing and creating curriculum like this. Heidi or Adrian, would either of you like to tackle that topic?
We might have to split it up. But I mean, on the logistics side, I think first of all, when you're traveling overseas to a new country, there's a lot to learn. There's a lot to be aware of and watch out for. It takes a lot of planning. I mean, if you plan a trip for yourself somewhere, you know, there's things that you have to line up and pay for, and you know, hope that everything's going to sort of pan out. And so, you know, when you have a group that you're responsible for, and you've got learning outcomes that need to be achieved, and you know, a really sort of transformative experience in mind, you know, the logistical side can be a distraction, and so it's very important to make sure that one way or another, a lot of planning and preparation, that goes without saying, a lot of planning and preparation goes into you know, ensuring that the flights are booked and paid for, there's somebody at the airport to pick you up, and so on, and that's where an organization like ours can help. And I think a further benefit is that we are based on the ground in the countries in which we operate in Africa, and so we have the added advantage of knowing the driver personally and having a lot of history with that person, understanding the vehicles and the you know, the different accommodations that we're recommending. And so I think, you know, that outsourcing that can, you know, can offer some peace of mind. But I mean, I think the biggest advantage is that it allows the group really to focus on the reason why they're there, and that's to you know, really get the most out of the learning experience. And so, you know, and we obviously, as I've said, we encourage that, and we do that through, you know, very hands-on program facilitators who help unpack a lot of the experiences. But if you don't have smooth logistics, then you're focused on we sitting on the side of the road waiting for a vehicle, or
Right.
we've got bed bugs or whatever it might be. So logistics is a really key key component, and one that's important to get right. And anyone can do that, but it's very time consuming. But yeah, Heidi, you can.
Better when experts do it, though.
Yes.
Yeah, Heidi.
I'll just add to that. I think sometimes we also forget how important logistics are in framing your experience on a program. So, for example, the choice of where you stay is quite an important one. Are you sort of staying at a US chain hotel in the country that you're visiting? Are you transposing all of your home comforts and everything to that new place and just going and doing sort of a bit of outreach work and then coming back into your bubble? Or are you actually immersing yourself within the context and the local culture and the people? The transport that you're using, is it allowing you to do that? Sort of, it's quite a holistic approach that you have to take when you're building a sort of a study abroad program or a global health program. So I think that the logistics, sometimes we just don't think about how important they are too in framing the type of experience that we want. And then just in terms of partnership and reciprocity, I think sustainability was also mentioned as a term. I think if we really want to ensure that partnership is created and partnerships are maintained, the process has to be consultative. And I think sometimes people can go into creating these types of programs with sort of very clear goals. This is what I want to achieve. I think it's important to be malleable and adapt as you consult with partners that you want to work with, because they might have different goals. And I think it's always about creating some sort of compromise. I think, if you're changing all of your goals for the partner, or they changing all of their goals for you, either way, like there's not going to be true reciprocity. So I think that's just important to remember. And in terms of sustainability as well, just making sure that there's longevity of relationship, that there isn't sort of a parachuting in and a parachuting out. And I think virtual can be so helpful in this regard, because you can have meetings and planning meetings and all these things beforehand, and there's opportunity to connect with partners afterwards via email, via Zoom, structured meetings. I think it just in general for EDU Africa's programming and our service learning programs, which obviously are more broad than global health, virtual exchange has been so impactful in enabling us to create more sustainable relationships with partners. And then just one more note on that, we have a standard practice, what we call a community needs assessment form, before we engage with any sort of project work, irrespective of discipline, with partners on the ground. And this is quite a comprehensive form that just sort of ensures that we follow that consultative process, that we're asking partners, what is it that you need? What is it that you would require or might want from sort of a partnership? And then sort of link those needs up with educators or professionals that wish to travel to Africa in a way that is sort of mutually beneficial. So that having that process in place is quite helpful.
Very good.
I'd just like to throw in one more thing, having been on the other side of that, and that is that the partnerships are really what makes the difference between like a tourist experience and a transformative experience, because partnerships can introduce you to people, to contexts that you would totally miss, and you would not get the deep understanding that you get when you have partners on the ground who are working towards common goals with you.
Mm-hmm. And I'd share just having homestay during international opportunities to be part of conversations at a dinner table of families about things that are going on in country. It was another way of adding context versus something you could never read about outside of that experience. This is a great place for us to segue into kind of the highlight of our webinar, and that is to introduce a workshop that is both virtual but has an on-site in-country option that we have been planning. And so we'll take some time now to kind of go through the in-country workshop that we have been planning together. So let's start off with why a workshop right now? Someone want to talk about that?
Well, I think
why would we do hybrid versus in-country? What would be, I mean, I think Heidi, you touched on this really nicely in terms of the pre-planning and the collaboration, but what is ideal about a delivery model that includes both online and in country for maybe our audience members. Donna, do you have a thought on that?
Yeah, I do. I was kind of waiting to see if Heidi had anything that she wanted to do. But when you're putting together a global health experience of any kind, there's so much planning that goes into it. And when you're doing it from far away, you're dealing with a lot of unknowns, and it's just so much richer when you have someone on the ground who can answer questions for you and can work out those logistical things and help add the context that you're looking for. So the tools are there's certain things that we all need. And one of the reasons for doing a hybrid is some of those tools, some of those background things that we need to know before going or when we're planning can be done virtually. But the experiential part, the really feeling the heart of what you're doing has to be done in country. So that's why we kind of came up with hybrid.
Yeah. Heidi and Adrian, would you say this meets the sweet spot in terms of only in country or only virtual, or what are your experiences with this?
Yeah, thanks. I think hybrid is something that was born out of COVID. We suddenly realized it is possible to engage people virtually in meaningful ways, and this opens up a whole bunch of different opportunities for us. We were, maybe it's not obvious, we were traditionally in country only, and we switched completely to virtual exchange during COVID, and developed the skills necessary to program virtually. And so now that we've got past travel restrictions and things like that, and travel has opened up, we've come to realize that actually, like what Donna was saying, there are certain things that make a lot of sense to deal with on the front end before you actually land on the ground, so that when you get to the ground, you can really spend, you can maximize the time that you have on the experiential learning side. And so there's things like working on understanding the culture, like you can do that online. Obviously, you can't understand it in its entirety, and there's a very big experiential part to that, but you can learn basic language. You can learn sort of some cultural do's and don'ts. You can engage with some of the people that you're coming to work with. You can start to build rapport with those people, and so it can really, if it's done well, it can really lay a really good foundation for an excellent in-country experiential piece. And I think that's what we're finding. And so we're actually encouraging whoever works with us to develop a program. We strongly encourage the hybrid, the virtual part ahead of the program.
Very good. Well, let's get to in-country discussion. So for this workshop that is being planned, where is the location, and what are some of the highlights of the location that participants could expect if they're interested in doing this workshop?
So we've chosen Kenya as the location. One of the reasons for that is that we have an office base there, a pretty large operation. We've got many really great partners on the ground. We've got excellent facilitators and support personnel. So logistically, it was a good choice for us, and we felt that we could support a group there very well. We'd also considered places like South Africa and Tanzania, where we also have operations. But Kenya is a very interesting country. It's culturally diverse. It's got I think 42 different people groups within the country, and so that along with a very big sort of urban population, but an equally large rural population makes it an interesting place to look at global and public health issues. It's got a very robust private sector, and it's got a functional and democratic government. We've just been through elections last year, and so it's a good place for such a program. It's a good place for participants to learn about the subject area, but also develop skills and intercultural competence, and so on. And so within the program, it's 7 days on the ground, and we've packed a lot into it, and we can go into more detail on that maybe another time. But we would spend some time in a more urban setting. We would very close to Nairobi, so there would be some time spent in Nairobi, which is the capital city of Kenya. And then later on in the program, we move into a much more rural and wild area, the Masai Mara, which is it's a very well-known national park, but the greater Masai Mara area has got a lot of it's a very interesting environment. There's a growing population of the Maasai people there who are from that area, and so so with that come all sorts of interesting issues to look at, and there's a lot of organizations doing really exceptional work in that area, but also in Nairobi. And so the idea of coming to Kenya, spending some time in Nairobi and Limuru, and then moving into a more rural setting in the Masai Mara is just to give a broad sort of perspective of the country and some of the contrasts within it. Yeah, so that's.
Thank you. It sounds exciting already. Not that we haven't planned it, but it just sounds exciting to hear it out loud again.
And one thing I should add, which hopefully is a carrot, is that when we are in the Masai Mara, we won't just be doing educational visits and so on. We will also be doing some game drives in that world famous park, where you can see all sorts of exciting animals. So yeah, hopefully that's join us.
Very good. Donna, would you share a little bit with our participants about what they could expect if they're participating for either pre-trip or post-trip debrief kind of ideas?
Absolutely. And I just want to say that, everything that Adria is talking about is really exciting, but it also is applicable to other countries. So that, just learning that cultural context, while it may be specific to Kenya, also that flexibility that you need to have, and many of the other things that we'll be talking about are really applicable to wherever you want to go in the world. So I'm just going to very briefly touch on what we're going to be doing in the hybrid section. So we'll start out, each session will be 2 hours long. It will start with an icebreaker. So we really encourage people to participate during the time that is offered, if at all possible. We will record everything, but it's much better in person. So icebreakers, then the first session, we're really going to be talking about ethics and some of the logistics of planning for health and safety, some of the teaching and learning planning that goes into it. Then the second one will get more into we'll recap a little bit of the first one. We'll talk about some of the challenges that often come into putting together a global health program and some tips from experts on overcoming some of those challenges so that you really are building your toolbox there. In the third session, we're really going to be talking more about acculturation, about culture, about language and how important that is, as well as a little bit into the healthcare system in Kenya and some case studies that, again, even though they're Kenya specific, can have, really good lessons for other areas as well. The last session that before we travel will be really focusing on getting ready to go, things like travel medicine, logistics of the travel, making sure everybody has their visas, just getting all those last minute details and questions figured out. Then Adrian's kind of gone through some of the exciting in-country things that we'll be doing. And that really is taking everything you've learned, turning it into an experience and learning to teach with experience. We want to have a post-trip session, and that one is because reflection is so important. It's important when you're taking a group overseas, but it's also important for this group. We want to talk about what our major takeaways are from this. We also want to do some mock planning and some networking so that people can really be prepared for next steps. One thing that I found that happens quite often with international experiences is people come back and they go, wow, that was great. Now what do I do with it? And so we want to make sure that, that we're really addressing that part of the adventure as well.
Yeah, I like that you said that. We really hope that by participating in this workshop, you'd feel equipped to move forward in planning your own integrated or hybrid global health programming, which we all as a group could help lead you through that. So to come away from this workshop feeling like you have the skills to do that is really important. Anything else from Adrian, Heidi, or Donna before we kind of talk about some final logistics and do some wrap up?
Maybe I could just add to what Donna was saying about reflections and how important that is for the in-country part of this workshop. We have actually built in an initial orientation, but then it's a short program, but a couple of other formal reflection sessions where we take time out, sit down and just really ask some structured questions around the experience so far and make sure that the learning outcomes that we've stated, because this is also built around outcomes, what we want to achieve, make sure that those are landing and being absorbed. Heidi, I don't know if you want to add anything there.
I think that's good, Adrian. I think if you want deep transformation to happen, it can't occur without critical reflection. So I think it's amazing that it's built so intentionally into the whole program, from I think the workshop level in terms of how it's structured and the in-country portion and in the portion thereafter. I just wanted to say, just in general, in terms of, I think, attending this kind of workshop, I almost want to say it's essential for someone that's planning on leading their own international program to go on an experience like this first, because you undergo your own internal transformation when you are in a country for the first time, and that's a whole process. So to have to do that for the first time with your students is a lot. So I think this just really, really prepares educators, professionals, whoever is wanting, or if the goal is that you want to lead your own program, it really prepares you in a way that you need to be prepared. So yeah, I just wanted to stress sort of the...
Yeah, I'm smiling while you said that, because really that's how I got involved way back when I first went as a participant, and then Donna shared, well, you'll lead the next time. And I was like, what? But had a chance to kind of process that experience as a participant before being the leader, and then mentoring someone else to do the same underneath or in collaboration with me before it got passed on to them as a leader and then another co-partner. So I like that you both wrapped us up in that way, but also touching back on that transformational experience. So with reflection, we've kind of come back around to how do we put into action the things that have to happen to make the experience what we want it to be.
The other thing that I just want to throw in here, as we're getting towards the end, is that global health is such a broad experience, and it needs so many participants that people that don't even think of themselves as being involved in health are really part of global health. Going back to the example I used earlier in Zambia, we've included artists, we've included sociologists, all kinds of people that we never thought in the beginning when we were thinking of health and healthcare, that there's so much more to global health, whether it's farming, whether it's art, whether it is sociology. And I mean, kind of my vision for this whole workshop is the ideal would be to have a really interprofessional group, whether people are educators or professionals, so that we can really learn from each other and share ideas.
Very nice. Well, that's a good segue into, we have a web form that we'd like to share with you. I'm going to put that in the chat right now, and we'll share it on our social media channels and websites as well. This is a web form just to gauge your interest in participating in this workshop, whether it be yet this summer in this current planning session for Kenya, or perhaps you're someone who is really interested in doing this, but you know that this is just not exactly the right timing for you right now. Certainly watching the webinar, but giving us some input as to what are your goals for a workshop like this, and when might this pique your interest in a way you can participate. So please feel free to fill that out for us. You might also be wondering, how much does an experience like this cost? And it certainly will depend on how many participants are able to go on the workshop itself. But you could expect anywhere up to about $3,600, but it could be as minimal as maybe $2,600, just depending on the number of participants. So all the better reason to ask your colleagues, and like Donna mentioned, kind of broaden that thought out of the healthcare field of who maybe else in your network would be interested in designing a global health curriculum that would meet their needs that isn't so obvious, because I think there's a depth and breadth to having interprofessional people at the table makes this experience better for all. But yes, share the link because it'll be less expensive also with more people. Our contact information is available on both of our websites. We have shared some global health webinar information forms through social media, so you can reach us either on those LinkedIn, Facebook, social media channels, or also at our websites. So with that, any final comments from our subject matter experts?
I just want to make a comment on the cost, that cost is for the program, does not include airfare and a couple little incidentals like health insurance and visas that are required.
Thank you for making sure that detail is out. Well, I would like to thank Heidi, Adrian, Donna for taking your time for this webinar today. We're just excited to share this content information with you and this workshop opportunity with you. We look forward to receiving any questions or comments you have. And with that, we'll close out our today's session. Thank you all.
Well, thank you.
Thank you so much.
Thank you so much.